Thanksgiving week arrives with the virus pandemic at its worst stage yet.
The number of cases, people hospitalized, and deaths are climbing, and health experts keep warning Coloradans limit those Thanksgiving celebrations. The most sobering updates from the state are the number of people who have died. Colorado's worst day in that regard, April 22nd, when 40 people passed away. We have now seen 3 days with similar numbers this month. 35 people died November 5th. It was 37 on November 9th and 34 on November 11th. The lines at some of the public testing sites are longer than ever as people rush to get tested before Thanksgiving. It's clear many people are going ahead with traveling and gatherings despite the warnings. Our Ellen Janae checked in at DIA, which is seeing maybe a lot more travelers than you might think. We begin with Karen Morford at the Water World testing site. Karen, doctors are warning a negative test doesn't necessarily mean you're safe for the holiday.
That's exactly right, Jim. And the concern really is that people are lining up at these testing sites ahead of family gatherings. But even with that negative test, the risk is still there.
As quickly as new testing sites go up in Colorado, so do the lines to get in. Many of those waiting simply looking for reassurance.
We just thought it was really important to be safe before Thanksgiving.
According to Dr. Dave Nida, that sense of security is a common misconception that comes with COVID testing.
A negative test is really not a guarantee that everything is going to be well and fine.
Instead, he says a negative test is only a snapshot of your health at the time of that test. Should someone have low levels of the virus, it may not be detected.
Even though a test, let's say at 3 o'clock, may be negative on a certain day, at 5 o'clock, that test could be positive.
Claudio D. Herrera is an example of that progression. He just recovered from COVID. His daughter was tested several times before learning she too was positive.
She tested negative, but it took 2 weeks for it to end up showing up, so people could be around it and not really know that they have it.
Overall, Dr. Dave says it should be viewed as a tool used with other precautions.
Testing is not a replacement for masks, social distancing, and staying within your own household when you get together for Thanksgiving.
Now, another thing that Dr. Dave says you should consider is the amount of time that it takes between getting that test and getting the results. There's a lot of window there for you to contract COVID before you get the results back. For now, we're live in Federal Heights. Karen Morford covering Colorado First.